My name is Molly Wright. I'm a senior at KU studying exercise science pre-OT, and I'm from Leawood, Kansas. I did my poster over the role of physical activity in children's emotional regulation and stress resilience. So emotional regulation is how you cope and express your emotions effectively, and then stress resilience is being able to handle stress effectively in difficult situations. I learned that physical activity is very important in children's lives, so incorporating it in schools, daily routines, and communities, it really helps them just be able to express emotions appropriately and be able to cope with stress. It was very helpful, and for grad school I'll have to do a capstone project, so starting out with something like this I think was helpful, and it'll set me up in the future.
My name is Brian Camarena. I did a project about the effects of exercise on hypermobility disorder. I am a senior. I'm graduating on exercise science with a minor in business, and I am originally from Mexico. Predominantly, I'm studying physical therapy, and one of the things that a physical therapist works with is people with hypermobility disorders. So that is what my project is about, specifically about hypermobile spectrum disorders and also hypermobile Ehlers-Danlos syndrome. It is a connective tissue disorder that affects both ligaments, joints, and also a myriad of other problems. My research was about if exercise and what type of exercise are beneficial for those disorders. One of the ones that I studied, I saw was the high load between low load on both shoulder strength and function, and another one was about if Pilates was a good exercise modality for patients with EDS. Specifically, the Pilates group was about pregnant women. The things that I discovered was there is not a definitive program that can actually help them. It is a combined effort of a lot of things. So one of the things that I found was that in the clinical applications, group workouts are really good for this population because it accentuates plan adherence, and specifically for it increases both the relativity to the group. It makes them feel better about having somebody who's going through the same thing as them, and both groups get progressively stronger and better. And then another thing that I found was that strength exercises do increase function and strength on shoulders. It is also specifically important for people with these disorders because over time they're going to have, if they don't do anything, it'll be easier for them to get subluxations and dislocations, specifically in really mobile joints, such as the shoulders or hips. It was very valuable. Again, since I'm going to go into PT school this summer, this is one of the people with this syndrome disorders are specifically going to PT for help to manage their symptoms. And doing this research gave me more insight on some of the things that I can do and some of the patients that will be coming to me in the future.
My name is Shivani. I am currently a junior majoring in exercise science, and I am from Lawrence, Kansas. I studied the effects of exercise on osteoporosis. I initially became interested in this kind of topic after talking to the pharmacist that I work with. She had mentioned that she has consistently been doing resistance exercises, and her sister hadn't, and her sister had gotten diagnosed with osteoporosis. So that had led me to my research study on how exercise affects osteoporosis. Osteoporosis is a very debilitating condition because it can increase your risk of falls and fractures, and so being able to mitigate those side effects is something that's very important. And so it was shown that resistance exercise has been the best exercise to not only maintain bone mineral density, but improve bone mineral density. Bone mineral density is important because osteoporosis is actually characterized by a decline in bone mineral density. And that pretty much sums up my research on this project. Throughout my exercise science kind of degree, we've learned that exercise is important, but what I learned from this is that it is really important early on. It is shown that once we reach our peak bone mass at around 20 to 30 years of age, our bone health starts to decline. So it's very important to start these resistance exercises early and build up that bone mass before it starts declining, because whenever we think about conditions like osteoporosis, we think of them as sudden and with old age, but from my research, it isn't sudden and it starts slowly, very early on. It's very valuable. It gives us some hands-on experience to how research works, and also just being able to go through the research articles is something that's really important that will be used in all of the health professions that we will go to in the future. So it was really important just to be able to kind of research this topic, learn more about what interests us, because it keeps us motivated to keep going to our professions.
My name is Carson Miller. I'm a senior exercise science student from Shawnee, Kansas. I did my research on the role of resistance training in preventing sarcopenia, which is age-related muscle loss, often seen in older adults. It can start around the age of 40 and 50. Even in advanced ages, one study conducted research on individuals aged 86 to 96. They saw 9% increases in lean muscle mass after an 8-week lower body resistance training program. Additionally, strength gains in the first 12 weeks of a resistance training program can exceed 100%, which is very important in reducing the fall risk and frailty of older adults and overall improvement in quality of life. What I learned is that this is a globally prevalent disease or condition, but it is reversible and preventable. Training at moderate to high intensities, one study saw training at over 70% of your 1 repetition maximum had the greatest improvements in lean muscle mass compared to moderate intensities. This is very valuable for those wanting to go into physical therapy or occupational therapy, working with older populations. This research can improve the quality of life and reduce the risk of injury for older adults.